Greetings, I'm Dr. Rozakis. I'm an ophthalmologist. I work with Brian Bakke, who's a PhD in biochemistry, and together we discovered a new treatment that stops or reverses vision loss from macular degeneration by healing eye cells. I've been in practice going on 40 years. Dr. Bakke is a PhD in biochemistry, and we have spent the last decade or two trying to unravel the complexity of macular degeneration, and we have a lot of great news to report. So this presentation is for people with macular degeneration, whether dry or wet, or if you have geographic atrophy, or if you have diabetic retinopathy, vein occlusions, retinitis pigmentosa, and other age-related diseases. It's for people with a family history of macular degeneration, people who want to preserve their vision, people who are losing vision, people who are having trouble with their grid or have failed something called the ADAPT-DX test. You know who you are. Or if you're having cataract surgery, or if you have dry macula in one eye, wet in the other, if you're having trouble driving, night vision problems, reading, this is for people with retinal macular diseases in general. This may not be for people who are unsure what they have. Some people just need a new pair of glasses, for example. Or maybe you have a macular hole, we can't help that, or an artery occlusion, or Fuchs dystrophy, or floaters, or maybe it's just too late. Maybe your central vision is completely gone, and we just really can't get anything back. And that's what this picture here represents on the side. Now there are four elephants in the room. The one is that the one-size-fits-all eye vitamins are just not adequate. It's not enough. It's a false hope. We have to do more. This standard of care of using simple vitamins for macular degeneration hasn't been updated in almost 20 years. There's just no evolution. There's no improvement. There's no effort to make things better. And I don't like that. The third problem is, and this is something you just need to be aware of if you're smart, is that you're stuck in a sick care model with financial incentives that lead to injections. That's just the reality of the situation. If you have dry macular degeneration, there's not a whole lot of financial upside for your retinal doctors to deal with. But if you have wet macular degeneration, that leads to eye injections, so there's a financial incentive. Just is what it is. Fourth, the answer to eradicating macular degeneration isn't being taught to eye doctors. They have to come to this lecture to learn that there's more that can be done. So let's dive in. We're going to really deal with how to eradicate this disease. Now remember, it's age-related macular degeneration. So the key is in the name. It's degeneration of cells that happens with aging. Okay, it kind of makes sense. So we have to unravel aging to unravel the degeneration of cells that are occurring in the eye and the body. Macular degeneration affects, as you know, many people, maybe 20 million. It affects quality of life with your hobbies, reading, driving, independence. It's a progressive, frustrating disease. That's the key word. It's progressive. It's a progressive disease. As you get older, it becomes more of a problem. And so we need to level out this curve. Now, the current vitamins are really just too simplistic. They're one size fits all. They do not prevent dry disease. They do not prevent wet disease. They don't prevent the progression of the problem. That's why people are getting worse and worse. They do not improve vision. They only help a small number of people, but at least they help somebody, 1 in 17. And it's an ancient therapy. It's old news. It's like this rotary phone here. It's just not slick. You need to do more. You need to ramp up and improve, like the evolution that occurred from the rotary phone to the iPhone. And again, it's a progressive disease. In the beginning, you can't see it. This is a normal appearing macula, but it may not be normal. There may be problems happening in the macula, which will lead to the development of structural changes shown by these spots here called drusen. And you can see these spots on special scans down below. See how these bumps and lumps correlate with the spots above. Here you don't see those lumps and bumps. And if the disease progresses, then it can cause leakage and bleeding shown here, and now eye injections are necessary to remove growth factors from the eye. So these injections are designed to remove growth factors from the eye. The disease can also take a turn and develop into geographic atrophy, where the macula starts to show areas, that's why it's called geographic, areas of destruction where the macula is no longer working. And interestingly, there are now new eye injections for this condition, but there are side effects to those eye injections. And there's ways of dealing with this problem here without eye injections. We'll talk about that. That's the bad news and why you are here. Now let's go over the good news. The good news is that serendipity, life took a funny turn for all of us. I was an engineer, went to medical school, studied ophthalmology at Duke. I pioneered PRK and LASIK, and I fell in love with anti-aging medicine. But to do it well, you need to be really skilled at biochemistry. So I teamed up with Brian Bakke, who's a PhD in biochemistry. He also has a master's in nutrition. He did his master's thesis on macular degeneration, and we've been together for 12 years working on a method to improve or stop cell degeneration. But we did that for general health, interestingly enough. So to make the method, which is shown in this picture here, we put together all of our knowledge and we combined it with certain blood tests to develop care plans to make cells healthy again. Now each of these nodes here represent strategies to help the cells. Cells might degenerate because of hormonal deficiencies. They might degenerate because of oxidative stress. They might degenerate because of methylation problems, which have to do with turning on good genes and turning off bad genes. The cell might degenerate because of inflammation or poor nutrition, or you might have a few bad genes that need to be turned off. All of these together need to be treated to optimize the biochemistry inside the cell. And if you do all of these together, it's like making a fist and punching. Each of these on its own is like a finger, and it's not enough to knock out the disease. You've got to do it all. That's why there's a picture of a fist shown here. Punch hard, make this cell healthy again, and not have macular degeneration. Now, the beauty of making cells healthy is that it benefits many conditions because most diseases are cellular. Dr. Oz said, making our cells healthier is the key to longevity and fighting disease. He's right. He also said, if you nurture your cells will nurture you back. So this is an important strategy. It's important to make your cells healthy again. We won an award for this. It was the Cranes Healthcare Hero Award, and here's my name on this award. It was very nice. It was the Advancements in Healthcare Award in 2015 for the application of this idea to general health, okay? But then we stumbled upon something. We started to realize that this method could also benefit macular degeneration. It started out with this patient here, who happens to be my mother. She had macular degeneration. So we put her on an anti-aging care plan, and I started to realize that her macular degeneration stopped progressing. It took a few years to see that, but it happened, and I was very excited about that. That was our first observation that we could do something for dry macular degeneration. And she went ahead and stayed stable for 15 years. So we found something serendipitously, finding something good without looking for it. But that's not enough. That's one case. But then a second case came along, and this was a patient who had improved dark adaptation. What does that mean? It means how long does it take for your eyes to adapt to the darkness, like going into a movie theater. If you can adapt to the darkness quickly, that's good. That means your macula is healthy. If it takes a long time to adapt to the darkness, that's bad. It says that your macula is sick. And this patient said to us, hey, guess what? I can adapt faster than before. So that was teaching us that we were making the cells in the macula healthier. The third case was a patient back in 2013 who improved. She had vision improvement, and we memorialize that in this write-up where we talk about vision improvement in macular degeneration using hormones, genetics, methylation, nutrition, and antioxidative therapy. And this person said very clearly that her vision improvement was noted because she could set her Kindle from large lettering, shown here, to small lettering again. Now this shocked us. This is not supposed to happen. So we started wondering, hey, maybe we have something here. And then this case came along of a patient with this large lump here in her macula, and nothing was working. She was receiving eye injections for that, and they were not working, as shown by these 3 pictures here. And then when she went on our program to improve the biochemistry of the macula, all of a sudden that lesion melted away, and she made the nightly news. This was a big deal. So with Dr. Baki and I started to say to ourselves, is this real? Are we actually making the cells healthy, which would help with dry macular degeneration? And are we also reducing growth factors in the eye, which are responsible for wet macular degeneration? So that's an important concept to understand. Growth factors cause wet macular degeneration, shown by this red arrow here, stimulating these blood vessels to grow up and in. And we were also making these cells healthy. Is that happening? Is that what these few cases are teaching us? So we did a study. We looked at people with dry macular and we looked at people with wet macular. And we were elated to see that in the 365 eyes that we studied, we found that we could stabilize just about everybody, which was really exciting, but also about half of them, or 48%, actually showed improvement. Well, that was monumental because this is a progressive disease that's not supposed to improve. And I can tell you, after watching these patients now for 5 years, we're seeing that in the long term, the improvement is stable. It's keeping. In other words, the disease is not progressing. We've been able to stabilize this condition even if they are years on the program. So that's great news. This is important. This is something to write home about. It's teaching us that it's important for patients to optimize their biochemistry before irreversible damage occurs. You should think of the biochemical disturbances that we're treating as little fires in the macula. Each of those little spots should be thought of as a fire. And if you don't put the fires out, it will burn the house down. And when the house gets burnt down, you lose vision and you can't get it back. So the key is to treat these fires before irreversible damage occurs. Just take that home. Remember that. That's important. Write to your friends about that, because that's the big news. Now let's talk to some patients. Here's a lady. Her name is Marilyn. She said, as I previously reported, my left or good eye tested at 20/50. After less than a year, it was 20/40. Now it's 20/30. And she's also been healthy for that long period of time. So she's an example of somebody who got better, who could see better. Here's a lady who had this really huge abnormality here, this large drusen, this spot, and it's gone. This is Peggy. And she say, hey, my huge drusen is almost gone. Who's ever heard of this? Yay. So her doctor's shocked, she's shocked, her vision's better, everybody's shocked. And we're so thankful. Now, William's an interesting person because he's somebody you need to really remember. His vision in his left eye had improved to 20/80. His vision was 2400, and he can see TV better. Now you would say, well, that's nice. He went from 2400 to 20/80. Well, that's a success, but it's a bitter success, because had we caught him earlier, we could have stopped him from ever getting to 2400. You see the point? If we had caught him when he was 20/50, like Marilyn, we could have stopped his vision loss from happening. But unfortunately, without the program, he came to us at 2400. We got him to 20/80. So it's a success, but it's a bitter success. Please don't be like William. Catch your disease before you lose a substantial amount of vision. Now, for wet macular degeneration, we saw improvement. Again, 60% of people showed less need for eye injections, and their vision also stayed healthy and good. And in the long term, they continue to improve. So this is important. So what we think is happening is that our strategy is actually helping remove the growth factors that are causing macular degeneration. So it's easier to treat these diseases or patients because the eye injections become less necessary because our strategy is helping the eye not create or produce or accumulate the growth factors. Maybe I didn't say that clearly enough. The programs we create reduce the creation and accumulation of growth factors. That's important. So therefore, it makes sense that you would need fewer eye injections to treat these eyes, which explains the 60% number, which is huge. Here's Jennifer. Just want to let you know that I had a very great news from my retina doctor today. He literally said, well, this doesn't ever happen, but your vision and your scans are improved. Woohoo, so very happy. Why is that? Because we're making the cells healthy in the macula and we're helping reduce the growth factors. Wayne says the wet macula is now gone from my left eye. Why is that? Because we helped reduce the growth factors. And I have unexpected improvement in the dry macula in my right eye. Why is that? Because we're making the cells healthy in the macula. And the eye doctor said this is the only case where the eyesight has recovered in wet disease given the condition it was in. So he's very happy, we're very happy. So now how does this all work? How do we optimize biochemistry? We need to know your history. What medications are you taking? What dietary supplements are you taking? What are your eating habits? And we marry that history with blood work. We look for deficiencies in your blood work. And based on your history and your deficiencies in your blood work, we supplement accordingly. And what that does is it has multiple effects on the cell. It reduces inflammation, reduces oxidative stress, it turns on good genes, it turns off bad genes, and that all of that changes what genes are turned on and what genes are turned off, which is called an epigenetic effect. Now, maybe I lost you at this point. I'm going to try to get you back. So when you look at a cell, the biochemistry inside a cell is determined by what genes are turned on and what genes are turned off, because your biochemistry comes from your genes. So if your good genes are turned off and your bad genes are turned on, you can have bad biochemistry. So it turns out that by creating our care plans, we can reverse that and turn on good genes and turn off bad genes, which will have the effect of improving the biochemistry. So one more time, where does your biochemistry come from? It comes from your genes. But a better answer is it comes from your epigenetics, what genes are turned on and what genes are turned off. Now, the good genes that are turned off with the aging process, okay, as we age, our genes that fight off oxidative stress turn off, rendering the cell very vulnerable to oxidative stress. Also, as you age, the genes that deal with inflammation become hyperactive. That's bad because inflammation causes destruction. So that's a problem. So if you're a cell inside the eye and you're subjected to oxidative stress and inflammation, you have a good probability of dying and having vision loss. And that's what happens with aging. Now, again, one very exciting example of epigenetics is the gene called VEGF. VEGF is the growth factor I've been saying repeatedly up until now. VEGF is the cause of wet macular degeneration. It's called vascular endothelial growth factor. Now, the eye injections, as I told you earlier, remove VEGF, but this method of optimization, these care plans, can turn off the gene that makes VEGF, and that's what accounts for 60% now of the success. Now, if you have dry macular degeneration and you're on this program, we can be reducing the amount of VEGF in your eye and thus slow down or stop the conversion from dry to wet. You don't have to wait until you develop wet disease to do this. You should do it when your eyes are in the dry state if you're smart. So the beauty of epigenetics is that it actually reverses the aging process. Aging is now felt to be related to bad genes being turned on and good genes being turned off. So if we look at your hormones, take care of methylation, can help you reduce inflammation, reduce oxidative stress, you eat smart, you can change the actual behavior of the cell so it can be a healthy cell that will survive and do you good. So once more, treat before irreversible damage occurs. If you're getting older, your biochemistry is changing, your good genes are turned off, your bad genes are turned on, things are starting to burn up and fall apart. You don't want that. Treat that. Now you can treat in the invisible phase. There's the different phases of the disease. You can have the disease without even seeing abnormalities in the eye. And the way to do that is with the ADAPT-DX test. There's a test called the ADAPT-DX, which measures how long it takes for your eyes to recover going from bright light to dark light, to dimness, to blackness. So if you recover quickly, you're healthy. If you take a long time to recover, you have a problem. And what we found is that when people get on our programs, they can adapt faster, which tells us we're actually able to help the biochemistry of the macula, even without seeing structural damage. See, there's nothing structurally wrong here. There's no lumps, there's no bumps, there's nothing. But the person is not seeing as well as they could be because they're not adapting fast enough. You can actually diagnose that if your eye doctor has the ADAPT-DX machine, and you can treat in the invisible phase, and you can improve the time it takes to convert from bright light to dim light. Now you should absolutely treat if you have drusen. These are these abnormalities, these spots as shown here. Now you're dealing with structural disease. This is a problem because it is going to lead to vision loss and it's going to lead to wet macular degeneration. You don't want to sit back idly and let this circumstance fester. You got to go after it. Not only are these drusen going to harm your vision and are signs that these cells here are not working properly, but if you have drusen, you're starting to accumulate VEGF. That's what the red arrow represents. So you haven't gone wet yet, but if you're accumulating VEGF, you're on your way to wet macular degeneration, and you don't want that. So you want to treat for sure if you have dry macular degeneration in the form of these structural changes called drusen. Take care of it. Don't let it fester. Now, this other condition called geographic atrophy. For those of you who have geographic atrophy, this is thought to be due to inflammation. And as I explained earlier, our programs can actually take care of inflammation, which means you have the opportunity to avoid eye injections. And you want to do that because there are side effects to the eye injections if you have geographic atrophy. So for that subset of people out there who are dealing with this condition, by all means contact us so we can help stop it from progressing. And finally, there's wet macular degeneration. Here is where the blood vessels are starting to grow in, causing havoc, bleeding, leakage, and now it's all systems go. Now we're at war with the macula. We have to inject the eye with medications to remove the growth factors. You got to get on the program to try to keep the cells as healthy as possible. And if you do that, we can help stabilize the condition if we can catch it early enough. So don't wait. If you have wet disease, get on the program. So one more time, if you nurture your cells will nurture you back. And that means making sure that you're hormonally optimized, that you're lowering oxidative stress, you're taking care of methylation, which helps your good genes turn on and your bad genes turned off, reducing inflammation, and using nutrition, and hopefully turning off bad genes that you have. If you do all of these simultaneously, like making a fist, you can treat before irreversible damage occurs and preserve your vision. So please treat before irreversible damage occurs. We don't want this to happen to you. We want to preserve your macula. That's your central vision. This is your driving vision, your reading vision, your seeing people's faces vision. If this macula starts to malfunction, you can't drive anymore. It's just a frustrating mess after a lifetime of living. You don't want to be dealing with vision loss. It's just not good. It's a lot of information. I hope you learned something from me today, that it is possible to actually stop the progression of the disease. We can reverse it, especially if we catch it early. That's the important point. And if we do that, we can eradicate the disease. If we catch it early enough, we can stop vision loss and you'll never have to even deal with this problem. If you've lost vision, we can recover vision. We can help you avoid injections if you have dry macular, and we can help reduce your need for injections if you have wet macular. And don't forget, we can also improve your general health, because when we do these programs and we do blood work, the blood work improves, which is also indicative of why it helps general health. And once again, this is for people with macular degeneration, dry or wet or geographic, diabetic, vein occlusions, retinitis pigmentosa, and general aging. All of these conditions benefit because all these conditions are dealing with the same simple problem of cellular dysfunction. Who is this not for? It's not for people who don't know if they have it. It's not for people who have macular holes, artery occlusions, Fuchs dystrophy, floaters. And it's not for people with end-stage vision loss or if you're on cancer chemotherapy. The way this works is we get your history, like we talked about. We do laboratory testing, which tends to be covered by insurance, not always, but usually is. And then we develop your customized macular program. We coach you on how to eat smart to preserve your macular function. Then we monitor you. We want you to have eye exams. We want to recheck your labs at 3 months and 6 months, and we want to be sure you're complying with the program. So we monitor people through telemedicine. It's a great way to do it. We expect stability of your macula after about 3 to 6 months. We expect improvement in vision in 48% of people. We expect improvement in your labs and improvement in your general health. We expect that you can have a reduction in your need for eye injections. The next step is to enter our telemedicine system, register, provide your history. You have questions for us, we have questions for you. Let's get our questions all figured out and answered, and then schedule a call with us. That's the steps. So the next step is to schedule a call, provide your history, and let's talk and find out if this is right for you.